I'm Dr. Chethana D. I'm a consultant rheumatologist at Aster CMI Hospital in Bangalore. Let's learn about psoriatic arthritis today. So what is psoriatic arthritis? Psoriatic arthritis is a type of inflammatory arthritis. It is commonly seen in people who've got skin psoriasis. So both these psoriasis and psoriatic arthritis are autoimmune conditions, meaning our immune system can mistakenly affect our own healthy skin and the joints. So by doing so, it causes a lot of inflammation in the skin as well as the joints, and if not treated promptly, it can cause a lot of joint damage in the long term. So who is affected by the psoriasis and psoriatic arthritis? Psoriasis commonly affects men and women in equal numbers, and it is usually more common in people who are 30 years and older. But of course, children as well as the elderly are also not exempted from both these conditions. So what are the causes of psoriatic arthritis? So although we don't know the exact cause for both psoriasis as well as the arthritis, we understand that it is more common in somebody who is genetically predisposed, and when a genetically predisposed individual is exposed to certain environmental factors like smoking, for example, sometimes some infections, can be more prone for developing psoriatic arthritis. It is also more common in people who are obese. Genetic factors, of course, play a role. Now, what are the symptoms of psoriatic arthritis? So, not everybody with psoriatic arthritis comes to us saying that they've got psoriasis and also they have joint pains. Some people may or may not have psoriasis up to the point of development of the joint pain. Some people may develop it later on in the stage of arthritis. Some people may not have any skin changes at all, but they could have nail changes which are called as pitting or onycholysis. So some people may be referred to rheumatologists by the skin doctor saying that this gentleman now has joint involvement as well. So the order of development may vary. So sometimes skin changes come later on joints, or it is vice versa. Now, what are the common symptoms of psoriatic arthritis? Psoriatic arthritis commonly affects joints of the hands, that is the fingers, the wrist joints, elbows, sometimes the shoulder, but it can also affect the spine. So not just the neck, but the lower part of the back or the lumbar spine can also get affected. And people can also have involvement of the knee joints, the ankles and the toes. Apart from the joints and the spine, typically in psoriatic arthritis, there's also something called as enthesitis and dactylitis, which we call as commonly as sausage toes or sausage fingers. So people can develop an entire finger swelling or a toe swelling as well. Now, people with psoriatic arthritis are also prone for developing other organ involvements like the eyes, for example. They develop something called uveitis, or they could have involvement of the liver in the form of non-alcoholic fatty liver disease, which is very common. So psoriatic arthritis is more of a syndrome X, or it is more of a metabolic condition as well. Now, how do we treat psoriatic arthritis? Psoriatic arthritis, the main state of treatment would be with medications called as disease-modifying anti-rheumatic drugs. Apart from these medications, these days we have newer medications called as biologic drugs, which work very well not just for the joints but also for the skin. So most of the medications that we use for treating psoriatic arthritis also take care of the skin condition. But some people may require additional topical treatment for the psoriasis, as well as some other medications which are specific for skin psoriasis. Now, apart from the long-term treatment, we may also sometimes have to use temporary pain relief medications, sometimes steroids, which could be oral form of steroids or intra-articular injections of steroids as well. Now, how do we manage a flare-up of psoriatic arthritis? So normally when the joint pain and swelling is too much, we advise patients to rest, apply a hot water bag or an ice pack, and do simple, gentle stretching exercises. Now, apart from taking regular medications, patients are also advised to follow a healthy lifestyle, maintain an optimal weight, do regular stretching exercises like yoga, Pilates, for example, and also aerobic exercises like walking, cycling, swimming, etc. So by following a healthy lifestyle and regularly taking medications, psoriatic arthritis can very well be controlled, and patients actually lead a normal life.